Hello everyone, good day. I am Frank Adeano from Group 24, and on this video I'll be talking majorly about tracheostomy. Now I have a clinical scenario where my patient has been in coma for more than a week and has had tracheostomy carried out. Now I'm to tell you, in this video you will know what tracheostomy means, what could cause tracheostomy, as in what could lead to the patient being given tracheostomy, what are the signs and symptoms to monitor in tracheostomy when the patient has tracheostomy, what should I care for, what should I be concerned to care for in a tracheostomy, and what does caring for tracheostomy include? A tracheostomy is a surgical operation that is mostly given when the patient will need to be on a mechanical ventilator for more than a week or so. And tracheostomy is a surgical opening in the neck that leads into the trachea, where a tracheostomy tube will be put right into the trachea and connected to the ventilator tubing, the ventilator opening. So this here is what a tracheostomy tube looks like. As you can see, the cuff that you can see at the top photo by the right is normally in tubes that are for multi-purpose that can also be used in feeding the patient. The tracheostomy is always held firm on the neck with ties or a special color device so as to avoid it slipping out when the patient coughs or any other sudden movements, so as to protect the tube in general. And the next question is, why could a patient need tracheostomy? Now, as I mentioned earlier, a patient could need tracheostomy when he needs to be on a mechanical ventilator for a week or more. And this is usually because the patient can't breathe on his own. So the opening is made and connected to the ventilator to help the patient with breathing. Your concerns of caring for the tracheostomy should be that the tube is always clear with no obstructions whatsoever, and that it is always clean, because hygiene is also very important to avoid bacteria getting into the patient's system and making the patient ill or causing sepsis. And you just have to make sure the area of the insertion of the tube is always neat, and make sure there is no obstruction. Caring for tracheostomy is mainly about keeping the tube clean, and this is done by the patient himself if he's conscious, or the nursing assistant. The first thing you have to always note is to perform hygiene, hand hygiene. You go to the patient, you make sure your hands are washed, you put on your gloves and you clean the area, and you make sure this can be done once a day or twice, or however you see fit, but mostly once a day. And always ensure that you do not forget to repeat this process if a patient has a tracheostomy tube installed or put in his neck. Thank you.